Why under-eye filler problems are so difficult to fix. Some patients develop swelling under the eyes months after trough filler. And sometimes dissolving the filler is not as simple as people think. Many people believe hyaluronidase instantly dissolves filler. But the reality is much more complex. Some patients develop swelling under the eyes months after trough filler. And sometimes dissolving the filler is not as simple as people think. Many people believe hyaluronidase instantly dissolves filler. But the reality is much more complex. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. In clinical practice, under-eye filler problems can present in several ways. Some patients notice persistent swelling. Others develop a bluish discoloration, sometimes called the Tyndall effect. And in some cases, patients report that the under-eye area simply looks puffy or heavy, even when the filler was placed months earlier. Because the lower eyelid skin is extremely thin, even small changes in filler position can become visible. What hyaluronidase actually does. When patients develop problems with dermal fillers, one treatment often discussed is hyaluronidase. Many people believe that hyaluronidase instantly dissolves filler and removes it from the face. But that's not exactly how it works. Hyaluronidase is an enzyme that breaks down hyaluronic acid, which is the main component of most modern dermal fillers. Dermal fillers are not simply liquid gel. They are cross-linked networks of hyaluronic acid molecules designed to last longer in the tissue. However, different fillers break down at different rates. This depends on factors such as the degree of cross-linking, the amount of filler present, and the location within the tissue. That is why some treatments may respond quickly to hyaluronidase, while others may require multiple sessions. What hyaluronidase does is break the chemical bonds within this network, cutting the large cross-linked gel into smaller molecular fragments. Once these bonds are broken, the filler structure becomes weaker and begins to degrade. However, the filler does not instantly disappear. The body still needs to clear those fragments through normal metabolic processes and lymphatic drainage. So hyaluronidase doesn't magically remove filler in seconds. It modifies the filler structure, and then the body completes the process of removal over time. Why the under-eye area is difficult. The reason under-eye filler can be challenging is because the anatomy of the lower eyelid is extremely complex. Several delicate structures exist in this region. These include the orbital septum, the malar septum, very thin eyelid skin, and a network of lymphatic drainage pathways. These anatomical structures help control how fluid moves around the lower eyelid. But they also mean that filler placed in this region can behave unpredictably. Sometimes filler sits in the intended plane, but in other cases it may migrate or be placed deeper than expected. In some situations, filler may even sit behind the orbital septum, which is called post-septal placement. When filler is located deep in this area, it becomes much harder to access and treat with hyaluronidase. This is one reason why some patients develop persistent swelling or recurrent under-eye puffiness. Post-HA recurrent eyelid edema. A condition described in the medical literature is called post-hyaluronic acid recurrent eyelid edema. This has been described in publications such as the Aesthetic Surgery journal Open Forum. In these patients, swelling can appear months after filler treatment. Intermittently, often worse in the morning, and sometimes triggered by salt intake, alcohol, or fluid retention. Several mechanisms have been proposed to explain this. One possibility is disruption of the lymphatic drainage pathways in the lower eyelid. Another factor is that hyaluronic acid is highly hydrophilic, meaning it attracts water. Even small amounts of filler in the wrong location can draw fluid into the area. Other possibilities include filler trapped above the malar septum, low-grade inflammatory reactions, or filler located in deeper anatomical spaces. Because of these factors, the swelling can sometimes come and go, which can be frustrating for patients. Why ultrasound helps. One of the biggest advances in managing filler complications is high-resolution ultrasound imaging. Ultrasound allows clinicians to visualize filler inside the tissue. This means we can locate filler precisely, determine whether it is superficial or deep, identify migrated filler, and detect post-septal placement. Ultrasound can also guide targeted hyaluronidase injections, which improves both accuracy and safety. Instead of guessing where filler might be, clinicians can see exactly where it sits. The key message is that under-eye filler complications are not always simple to fix. Hyaluronidase is an important tool because it helps break down the filler structure. But once the bonds are broken, the body still needs time to clear the fragments. And when filler is placed deep, especially behind the orbital septum, treatment may require multiple sessions and careful imaging guidance. Another important factor is patient selection. Not every under-eye hollow is best treated with filler. In some patients the issue is related to fat protrusion, skin laxity, or structural anatomy. In those cases, filler may not be the ideal treatment. If you are considering trough filler, it is important to understand that this is one of the most technically demanding procedures in aesthetic medicine. Proper patient selection, deep anatomy knowledge, and conservative technique are critical. Thank you for watching. We hope you found this helpful. Don't forget to like, comment, and subscribe for more.